Good afternoon, everybody. How's everyone doing? I hope that after that awesome bumpy cake you guys all ate, that you still are awake. So it's great to see everybody showing up. This is our third panel discussion of the day, and this one is focused on healthcare, which, it's good to get out of the everything being auto manufacturing related when you're talking to a bunch of folks in the Detroit area. So I'm glad you came. Today, what we're going to be really focused on is talking about, how data-driven healthcare can transform patient outcomes. So we have three great panelists today. Before I dive in and give them a quick introduction, I'd just like to say my name is Mark Fisher. I am the Director of Analytics for a company called Mission Veterinary Partners, so vet hospitals, dogs and cats. And fun fact, I used to be a WIT team member, so back in 2020, so it's great to be back, great to see all my old teammates again. So on our panel today, we got three great panelists. We have Fiona McPherson-Grant, who we'll be introducing quickly here. We have Amber McKenzie. And for those of you that were here this morning and got to see Dr. Greg Wells, and they'll be handling all of the different topics we cover today. So why don't we just dive right in and let you guys introduce yourselves and do a quick intro before we get into our Q&A.
All right, so I'm Fiona McPherson-Grant. I've spent over 20 years inside hospitals, always in the data and analytics space, and have recently, from there, transitioned over to the vendor side. I am a New Zealander. A New Zealand company was launching data and analytics platforms in the United States and really needed kind of an insider who could speak American, speak New Zealand, speak healthcare. And so it was a crash course in how it's same but different. So from there, we recently sold and I opened a consultancy. So I'm exploring new waters, and this is great today. Great panel. I'm excited.
Excellent.
Hi, I'm Amber McKenzie, and I'm the Director of Business and Intelligence for Trinity Healthcare, specifically for Michigan medical groups. You may have seen some of my colleagues this morning present. So we started out as IHA, and we're really focused on primary care for patients and specialty, all of the services that are outside of what you get in the hospital. So in my area in particular, we deal a lot more with operational metrics and how to support the business, which in turn helps the patient outcomes, but my answers will be more about operations than direct patient care. So.
And I'm Greg. Most of you, I think, might have seen me this morning, so you know what I'm all about. But when it comes to data, I'm an MRI researcher at SickKids, so we use exercise to prevent, diagnose, and treat chronic illnesses in children. I do a lot of MRI research, which are huge, massive data files, which we run through all sorts of different types of analytics to get data that we can use to help patients. I'm also off tomorrow to go work with Stanford and 800 of their doctors to use wearable technology to track their sleep, nutrition, exercise, and stress to see if we can predict outcomes in physicians, hopefully, which will then improve patient care as well. So all sorts of different things that we're doing there, but hopefully some of that's relevant for all of you today too.
All right, excellent. Welcome, everybody. So for our first question, we're just going to kind of dive right in at a high level, and it's really, how are healthcare organizations leveraging data analytics to improve patient outcomes? You want to start, Fiona?
We'll start off.
Go down the row.
So while I was at Corewell, I was working on some work with a high-risk, underserved community clinic. So new line of business for them, and it really started with the analytics. So looking at those high-risk patients, where they were geographically located, kind of realizing that they were sort of core around a hub, and then diving into them, what are their special needs, what makes them underserved. So you can really sort of see correlations in SDOH around homelessness, substance abuse, and sort of unmanaged chronic disease. So then you're doing another layer of reporting around that. And then you're putting on the risk scores, what is their risk for an unexpected ED visit or a longer inpatient admission than anybody else, who is, not getting their screenings, what's their ACG risk score, sort of there's really advanced sort of predictive modeling that you can do to kind of really pinpoint then the needs of those people. So, we could target the neighborhood to set up that clinic, and then impanel those patients, with really specialized care management, and then auto-assign them into the programs that met that sort of set of needs that we'd identified in the reporting. And the results have been amazing. So I think I looked at the stats this morning, there was like 1,578 per 1,000 ED visits for this population. And in 12 months, they got it down to 934, which is like massive. And then for all the screenings of the chronic diseases, just improved overall. But I looked at COPD, and it was 77% adherence last year when it was like 32% the year before. So using analytics to sort of look at your broad population, and then using social determinants data to then narrow down on the special needs, and then narrowing that down on risk, and then like targeting those for like specific interventions in a new clinic in a physical way. So to me, it's the marrying, right, of the technology with the physical interventions to then really move the needle on healthcare for actual real people who need help.
All right.
So yeah.
Thanks. That was a deep dive. That was awesome.
You got a data person.
Yeah,
I'm going to go in there.
Amber, any thoughts?
We do a lot of similar work, actually. But one of the things that comes to mind with this question is kind of piggybacking on that is the access to care. So one of the goals for our medical group is 7 days from the time the patient calls to actually being seen by a doctor. I think everybody in this room has had experience probably with calling to, if you get a referral to a new provider and you get they say, I can see you in 3 months, or or you can go on a wait list and possibly there'll be an opening. So looking at data a lot more closely to figure out what are those barriers to access to care. And sometimes it is those social determinants of healthcare, but in other cases, it's just availability. We've got hundreds of medical practices out there, and some of them are super busy and some of them are less busy. So really looking at that data to determine, our division directors have actually moved popular providers to spend more days in different areas at a different primary care clinic to ensure that the patients can be seen a lot faster. So that's one of the ways that we definitely see our data making an impact, and then our leaders incentivizing our providers to take on more new patients, to see patients faster, while also then we balance that out with quality of care metrics, so we're not just getting people in and out quickly, but we look at from all the different angles of also, are they meeting all the recommended tests at the right time? Just really a lot more information about patients in general from that holistic viewpoint of healthcare.
Great.
That's awesome. I'll just give you some observations about what I'm seeing at Sick Kids in Toronto and Stanford in California. So the first thing I'm seeing is AI note takers to help doctors take notes when they're interacting with patients, because that takes forever. So instead of after you see the patient, you have to type in the notes of what happened. There's an AI note taker that does that automatically as you go, and you just go straight into the next patient. So that's one thing I am seeing. There's a lot of resistance to that. So about 30% are thrilled with it, 30% don't really care one way or the other, and 40% don't want to do it at all. So my wife being one of the 40% that doesn't want to do it at all. Therefore, it's an interesting trying to navigate people to move forwards on that one. Second thing I am seeing is the development of an AI co-pilot that a physician can use to double check their thinking. So that there's a decision tree matrix that is created for a specific disease. And as you do an intake with the patient and you're going through your decisions, the AI will double check the flow chart of what happens with that patient as you're working your way through it. And it's simply a co-pilot. It's double checking what you're doing, and you can refer to it later to make sure that what you think is the right path, that it agrees with you, or maybe suggests something else. That's a little bit further down the road, but that's in development. What I am doing with wearable technology is trying to collect data on sleep, exercise, and stress from GPS, heart rate, and a couple of other sensors that are available. And what we're trying to do is see that if there is a change in one area, let's say sleep, does it pre-predict changes in other areas? So for example, if we notice that your sleep is decreasing, does that then subsequently result in or is associated with an increase in stress in a week or two? So we're trying to use predictive analytics to see if we can pre-predict challenges that might happen in the future, or actually improvements in the future based upon wearable tech, which most people have on their wrists these days.
All right, that's awesome. My next question, I know some of you did dive into some specific examples, but my next question was going to be around, are there any just real interesting quick hit examples of leveraging advanced analytics for like an individual patient outcome, or even just the operational efficiency around working with that patient?
So I'm a total data nerd, so I'm always like gravitating to that lens when I'm thinking about things. I always struggled as a report writer with the unstructured data. So the notes and, you know, the results of that person in the room contact that you're having, someone that holds all the nuggets of the good stuff. So yeah, at Corewell, one of the first projects that I championed was bringing those unstructured notes in and then giving them a bit of a shape so then you can get the data out for the analytics. And that's been really great for looking at those little interactions like a surgical site infection or some of these things that just end up in the narrative, but then they're really telling for reporting and follow-up that can really help patients down the road. So, yeah.
All right, great.
So I keep piggybacking off of your answers because they lead naturally into something that we're doing. And we're also, we have a project right now, and we call it Auditor Copilot, and that is to look at patient chart information and pull in those clinical notes to really analyze. Our auditors that do our billing, they look for errors in what we're billing out to the payers or to the patients themselves, but they do it manually, so they can't go through all these charts. So we've started to look at ways to automate that, and it prevents billing errors. So there's less overbilling, there's less rejection of claims, there's less patients getting a bill in the mail saying that your insurance provider didn't pay that. By reading the clinical notes and looking at the diagnosis and looking at the CPT codes that are going out. And I say it's doing that. We want it to do that. That's more of a future state, but this is the project that's starting now to really build in, looking at that advanced analytics and how we can use it best to make us more operationally efficient as well as prevent errors.
Yeah, and I guess there's just a couple of other examples that we're seeing right now, and that is the use of AI to analyze MRIs, CAT scans, and X-rays. Technology does very well with that, especially once you've trained it on a large data set of what does breast cancer look like. It's very easy to upload a scan and see, rapidly move through a lot of tests, which then just get checked by a radiologist rather than analyzed by a radiologist. So there's been a tremendous uptick in terms of the amount of cases that can be assessed and managed by one particular physician throughout that process. So that's one of the other things that I've observed, which is really interesting too.
Great. So a lot of, we're going to
jump in with it.
Please.
So before, when you were talking about that flow charted guidance during a visit, I think that's super interesting. I was reading about that recently. It's a way to sort of get bias out of the interaction, which I think is sort of one of the super sort of powers of AI going into that workflow, is they can ask the questions that you don't think of because that's not your viewpoint.
Yeah, and so actually to leverage on, to pull on that thread a little bit, what the patients say is that they feel like sometimes they're going through a workflow rather than having a real interaction because there's certain questions that have to get asked in order to fill the database. Yeah. And so it's delicate between using it as a co-pilot to take notes for you, but not being driven by it. And so one of the things philosophically that we're trying to think about is always placing ourselves between the AI and the patient. So the patient, the AI operates in the background. It's behind you. It's a supportive, not the thing that interacts with the patient. Although, obviously, there's some pressure right now to make the AI the actual frontline triage, but we'll sort of deal with that maybe a little bit later. But yeah, that's the tension that exists there for sure.
Thank you.
Great. So that actually leads me to a question, which is, how has adoption by doctors and practitioners been with all these new tools and everyone always kind of feeling like they've got their own personalized spin on, their engagement with their patients? How's that experience been developing lately?
So I've been doing a little work with Ambience. They're an ambient listening software, and they're saying, a successful metric for adoption for them is about 30%, which is in line with what you were saying, and that it is a long road to get that buy-in, and it's new. and they're working on it, and it's hard work, and it seems to be pretty similar metrics for a lot of people in the ambient listening space.
Interesting. Amber, any?
I mean, so again, we look at data to see how the tools are being used and see the adoption of the providers, and then try to see if that makes them more productive or better job satisfaction, things like that. But I don't directly deal with it as much. So on the back end, we're looking at more at what we can do just to alleviate that, more of the technical burden on the front end providers, so they just don't have as much of the uptick of all the administrative tasks that they're doing to help them be able to focus on patient care.
And so I'll pull on that thread because that's such a good idea. So I'm the performance consultant for this Stanford group. I'm a PhD, not an MD, so I get to watch what happens, not actually have to do anything as a consultant, which is awesome. But what I have observed is that, yes, there are 30% who are all in, 30% who are like, okay, fine, I'll do it, and 30 to 40% who are hyper-resistant. However, for all of them, there is a period of adoption and change, which requires an enormous amount of energy against a backdrop of they're already pushed to the absolute limits in terms of time and burnout. So if you are going to be successful with implementation of any of this, you have to remember that there is a massive increase in the amount of energy that is required by someone who is implementing a new system into their existing patterns and structures and routines. So support must exceed risk. Therefore, if this is going to get implemented properly, the amount of support that is required by everybody is 2x, 3x what is normally required until it is implemented. Then you can begin to withdraw some of that and reallocate that energy, time, effort, and attention to something else. So when we are changing, when we are learning, when we are adopting, and we are adapting, there's an enormous amount of pressure that exists that must be overcome with more energy, and then what do we do as leaders? More support. So, yeah.
Great. Before I ask this next question, I just wanted to mention something that I've personally experienced in the last year. Our veterinary hospitals started using a tool called ScribeNote, which is really sort of collecting all of the doctor notes and formatting them. And for the very first time, we started seeing client feedback, which is the pet parents of vet hospitals, saying, I felt like I was, being monitored or being interrogated. It was the first time that anyone has ever acknowledged that they felt like they were in, the actual exam room going through some sort of a structured discussion or being, under some sort of influence of AI. Has there been any sort of, discussion around actual patient impact as we leverage these types of tools? I know Greg mentioned it a little bit, but just in terms of, are we seeing that as any type of a concern when they're physically present in an exam room?
No, I don't have any knowledge on that, but I couldn't see how it would feel overly structured and really formatted. There is always a danger of that.
I mean, I think from myself being a patient too, you feel like you're repeating the same information over and over again as you go through the whole process. So if I'm in a room and the provider already kind of has things coming up and doesn't have to ask me again or read through as much, I think that could only be good. But I do understand what you're saying. I think the leveraging of chatbots and things like that for more like within my chart, where it's the patient asks a question and they can get a quick answer back or get a prescription refilled, maybe that's the right place for it versus, right in the room with the doctor.
Yeah, it really is an art and a science. And so you have to you enable clinicians to practice the art of whatever the medicine whatever their field is. And that's really the key thing, is that they are able to actually navigate and solve problems. For the simple things, it works beautifully. For the more complex, where there may be 2 or 3 things at play, then it becomes really, really difficult. As of right now, it will get better. But it's definitely, there's a tension there for sure.
Do you find that the patients are actually aware that these tools are being leveraged, or is it sort of unknown by them?
They are not initially, but then they become aware, and when they are aware that there's AI at play, there's definitely not always thrilled about it. And so it's just right now it's new, and so it's unusual, and there is that additional structure that it forces you through that feels a little bit clinical or sort of mechanical, I should say. So yeah.
I mean, what a loss it would be if we structured this so tightly that we missed the connections of those unique, elements, and then didn't have the innovation or the discovery, right? Because it's new, so it wouldn't be in the structure, and then you wouldn't be able to discover it. So yeah, let's leave room in there for the magic and the innovation. Yeah.
Yeah, I've seen. I just listened to a podcast where they were talking about using AI more for that front end, the questionnaires for the patients before they get to their healthcare provider. And one of the things they said they found, and I don't know where the research came from, but they said that they found that one thing is the patients were more honest when they didn't think they were interacting with a doctor. If you've been to an appointment where they're like, so you drink like once a week, you have one drink, and you're like, I've seen my mom do this. Just, yeah, I'm like, okay. It's in the way that the question's worded, but I think on the flip side, so the patient may feel more open because they're not talking to a real person who's judging them. But then you also miss those cues in the way people's face look or how they're reacting or how they actually feel about something you're saying. So definitely a balance.
All right. So one of the challenges of just healthcare organizations overall is there's a money and profit component, and then there is a patient health and outcome component. As a lot of the new technology in the analytics space, whether it be advanced analytics or AI tools, how are you seeing that being either applied or being, how is leadership approaching leveraging that sort of between those two worlds? Any thoughts? I know this wasn't on your pre list, but I wanted to throw this in as an interesting question.
I have a thought because we're launching a technology innovation as a service, and really looking at what's our future, and in knowing, it's always going to be about reducing costs, right? And where can we get more efficient? So we're really asking our leaders and practice managers to look at all those manual tasks and things that we can help automate with technology and hide that from the end users so we can really make things more efficient, turn out a lot more, verifying insurance, prior authorizations, and things that are just tedious manual efforts to just really back end that type of work to just make us more operationally efficient. That's one of the ways.
I'm going a bit radical here, but I think as we're doing this AI work, quite often these tools that we're creating for our own work really can be packaged quite easily these days with the tools we have into applications. So it does open up, kind of a side hustle business for some healthcare organizations to package and sell those AI tools that they're making for other organizations in the community, which is completely different and a little bit radical. But, we don't have to recreate the wheel every time. And if someone's done something great at Stanford, then, we have the ability maybe to share that. So it's a monetary opportunity, I think, for some organizations to grow in that way.
All right. I guess my follow-up question for you, Greg, would be, it seems like there are a lot of leaders in the healthcare world that might be focused on organizational efficiency or even potentially like marketing, and they're the ones that have typically been super aggressive on leveraging analytics. You're one of the few folks that really is leveraging the new technologies on really patient outcomes in the actual health component. How do you just see yourself, as kind of out there in the world, and, are there other, I guess, true medical professionals, true doctors that are really gravitating toward leveraging the technology and trying to carve out enough of at least a movement toward leveraging the tools to really provide a boost in health?
I think, I've gone to a lot of therapy to cope with this answer that I'm about to give you, and that is the fact that I'm an entrepreneur stuck in an academic environment. And so I'm constantly thinking like, oh my gosh, I could build this app that would collect all of their sleep data automatically and track their heart rate variability, which means I'll know their stress. And then I'll see how much they're moving. And based upon their voice, I can tell whether or not they're depressed. And that would enable me to predict who's going to be in trouble first, so I can intervene there and solve that problem. And I say that to people, and I just see like everyone's face is just sort of glossed over, which always brings me back to trying to remind myself that leaders will think about the benefits of implementation of AI and all of these technologies. They will see the outcome. They will see the efficiencies. They will see all of the end benefits. The clinicians and the practitioners will be the ones who are going through the process of implementing it, of using it, of actually making the changes, of interacting with the patients. For them, it's exponentially more challenging to do that because it involves alterations, changes, thinking, and it's more challenging to move through that. So if I can get the leaders on board, and most of them are, they want to do this, they recognize they have to do this, then the magic is making sure that you help the clinicians implement it, and most importantly, you really help them use it to make a difference for their patients, because that's why they're doing what they do. And so as long as you're constantly thinking in your head, how do I help this clinician make a difference for their patients, and do it as easily as possible, like what would this look like if it was easy, then you can win. So that's sort of the line of thinking that I'm trying to adopt as I implement these things.
I've been thinking a lot lately about value and how we have the value conversations around these AI tools, because you see the metrics out there around ambient listening, and they're a lot like EMR metrics. And I just don't think that that's really the same story now with the products and tools that we're using in AI. So I'm trying to think about ways to extend that conversation to show the other areas of value for these AI tools that we have, and trying to design a framework to kind of like show that sort of visually, to like prompt those conversations for people. And some of those values are now and they're monetary, and some of them are like in hearts and minds and they're a little bit longer term. And so I'm just trying to think of a framework to like have those conversations and have people see, oh yeah, there's more layers to this than I've kind of thought about so far.
I think also just the value in, as we do free the data more, and of course we have to be careful with PHI and HIPAA regulations, but the fact that we can start to share more and more information across the world on all of these different types of patients, and then start to really get way more insights and notice the trends. I mean, it's not, it's a tool for the providers to use in their patient care, but it's not something that every day is part of their workflow, per se.
Yeah, maybe. Who knows?
Yeah, before I get to my next major question, has there been any sort of change in patient engagement recently with some of these new tools or capabilities? Have you seen that emerge at all, or is it pretty much trying to nag people to get back in when they should be in?
Yeah, I mean, we definitely look at ways to reach out to the patients and how people respond. First of all, you have to have their permission to text them and leave a message that says anything about patient care. But definitely we look at a lot more proactive ways of reaching out to patients, or if we bought a medical practice, like, are the patients from there coming in and retaining? Are we retaining them? We look at continuity of care too. Are we keeping in our health system so that we are sure that, if they're due for a mammogram, that they came and got it. If they go outside, we sometimes don't know that they actually got it. So I definitely see, our interaction with the patients, trying to be more proactive in looking at things, and as you mentioned, the risk scores too. So if they are on a higher risk score, how are we dealing with that? What are we doing proactively? One of the things that our Quality Pop Health team did last year was they were looking at health equity for hypertension, and they were seeing in the African American population, they were seeing a higher level. So in looking at a lot of different data that we took in, and the social indicators of healthcare, the questionnaires that we send out, they set up some blood pressure monitoring stations at barber shops in different areas, and we're able to really engage that way. So just looking outside the box in different ways of taking that data and actually making it meaningful. Because you can look at all the data and it can tell you a lot of different things, but how you react to it and what you do about it is, that's where sometimes the human part of it has to come in and make those decisions.
So there's a lot of new stuff on the horizon, a lot of new tools, technologies. Sometimes it seems like every month there's a new version of ChatGPT or some prompting tool or some new crazy thing that's flooding across LinkedIn or Instagram or one of those things, right? How do you plan to, work these emerging technologies into a large healthcare organization where it may require a long runway of ensuring all the data is structured properly, models are built properly? Like, what are some of the things, that are coming in the future that working toward investments on as we're going forward in the next 3-5 years?
I want to start with their strategic plan, like what are their organizational goals and how do they see themselves and what their future is for them, and then looking at those core problems and pain points and opportunities, and then looking at the automation and the AI tools. If you come at it the other way around, it's that when you've got a hammer, everything looks like a nail, and I think maybe that's where we get, we're talking about hype, or maybe that's just like misaligned expectations. If you're going in with a pain point that we've already sort of known and acknowledged, then you're going to get the buy-in and the support of your stakeholders because they want to fix that problem too. And if it happens that you're fixing it with the EMR, that's great, or maybe you're fixing it with a collection of AI tools, embedded in with that as well. So yeah, it's easy, really easy right now to get distracted by all the super cool new tools and like, hey, I want to use that and tell everyone I'm using it. But I just think that that's how we end up in this pilot purgatory and kind of places that we don't, want to be in right now. So start with the end in mind. It's one of those good 7 habits, and then go from there.
Yeah, and then the really important thing is not to be reactive. Just because something is new and interesting and hot doesn't mean that we need to implement it right away. It's just trying to, as you mentioned, think about the pain point and solve problems. And you don't need to be first on this. In fact, it would be probably beneficial to be about 30% of the way in on the early adopter framework. So we want to make sure that it works, that it is actually solving a problem, and don't feel the need to be reactive. It's much better to respond than to react when it comes to all of this, I think.
Yeah, I think that grassroots evangelism, get 10 people using it really well and then kind of scale from there. It's easy to spend a lot of money fast.
Yeah, we don't want to reinvent the wheel or spend a lot of time on something that a large software vendor, Epic, Cerner, is developing. And so if we take it in-house to say, hey, we see this problem and we're going to start spending all this time on development on a solution, and then we see their roadmap and they're coming out with it next month, we're never going to be able to keep up with software development that, a big, huge, large company is. So we have to pick and choose what we want to actually work on.
If you are working on something new and exciting and you've thought of it first, that's great, but find a developer partner, like find a vendor who is kind of closely aligned, and then you can kind of work on it together. They'll end up with a new product and you'll end up, designing, working it with them. I think there's more opportunities to do that than maybe people realize, but it's win-win perhaps. Yeah.
So real quick, before we wrap up and turn it over to our guests here, Greg, I think it sounds like you've partnered with some of the more elite institutions across not only the US, but the world. Do you find that they are early adopters, they're doing the most innovative stuff, and then once that happens, how does it sort of trickle out to the rest of the world and get down to all the other healthcare organizations?
Whoops, something just died. Oh, I'm throwing headphones all over the ground. Anyway, so I'm really, really grateful that I've had the chance to work at the University of Toronto and Sick Kids Hospital and Great Ormond Street in the UK and Sydney Children's and then now Stanford University Medical Partners. And obviously with those organizations, you're well-resourced, you have some of the leading thinkers, and so you're inevitably going to be at the cutting edge. But what I said about not being reactive is really important. I don't think anyone there feels the rush to do anything. I think that the sense that I get is we have to do this, but we have to do this right. So let's slow down, let's implement things thoughtfully, let's make sure that it's done very, very well, and let's only do one or two specific things, let's not do a lot of things. So it's really, really deliberate, really, really intentional, and I do not feel in any of those locations like it is being rushed. I do feel like there's no choice. They have made the decision to go down the road. We are going this way. We're just, and some people don't like that because people just don't love change. But it is deliberate and intentional. And of course, once it's then modeled and once it's figured out, then I love the idea of sharing that with everybody. Because let's face it, like healthcare is something that all humans need. So if you can create something that you can then license to other hospitals, that's amazing. And we should absolutely do that for sure.
Mm-hmm.
Any final thoughts before we open it up for questions?
No.
No? All right. Any questions from the audience here today? So we have 10 minutes left for questions. So we got these folks here. Would you like to come up to our microphone here, please?
It's my lunch buddy.
Hey.
So, and I feel extremely close now. So my question is, as we look in your experience, as we talked about what we can help our providers, how it's going to help our patients, what about care coordination? It feels that's a growing gap. How do we get our doctors to talk to each other? But also, speaking to some of the technology you're already thinking of, is there an opportunity that doctors' offices can import my Fitbit information and have that and track it? And do you see that happening or like an ideal state in the future?
Yeah, so I'll jump into that because one of the things that we're seeing quite a lot right now is people showing up with 3 years of data already. And so it's not like you're just ordering tests. They're like, no, it's okay. I understand exactly what's happening with my sleep. Here's 3 years worth of data on all the stuff that I've already analyzed. So there's no question that wearable technology has democratized access to your own physiology, which is fascinating. The challenge with what we're seeing is that these devices are incredible. They're very, very reliable. If you see changes, they are real. The problem is the validity is not awesome, which means that you're not 100% sure if what you're tracking is really what you're tracking. So they're like 0.6 to 0.8 associated with whatever they say that they are actually tracking. But if you see changes, they are real. So I think wearable technologies in conjunction with validated gold standard testing is where the future will lie. So there may be a problem. Physicians or the clinical care team can order certain tests that are well established. And then when you relate that back to your actual wearable data, you have that association, then you can test it and track it on an ongoing basis moving forwards. So I see a future where it's both. Individual personal health data that you track yourself using your wearable technology. I actually believe that we're at the beginning of a merger between humans and tech to create a new species. That's a bit more than we need to talk about today. But I do see that that's the pattern that will exist moving forwards, is using this to track changes based upon this data and the data that you get in a clinical setting. I don't know if that answers your question or not, but yeah.
So when I was working at Orion, we were working in the countries that had public health and did large-scale health information exchanges. So in the States, that kind of presents itself as a HIE for public health. And the tools that they were working on was bringing in, all the independent, like hospital and physician office data into a centralized hub. And then it can be accessed by different providers to sort of see that full set of care for a patient. That technology has improved recently with the moving to the cloud. We can move more data faster. We're getting much closer to real time with that sort of health information exchange. And so that's going to open up a ton of opportunities where you're not, waiting long periods of time for information to go into the hub and then be available. So I was working with Synchronous in New Mexico, the health information exchange down there, and a case manager was telling me how her husband was super happy that we had done our last upgrade. And I said, well, why? And she said, well, she worked with the homeless population, and she would get a call, like physically a text message on her phone when somebody was discharged. She'd get an alert. And so she would jump in her car and drive cross town to the emergency room and drive around the parking lot trying to find, the homeless patient to then redirect him into a shelter for the night. So she said now she would get an alert on a admission that was almost real time. She could be at the hospital halfway through his visit, be present for the second half of that encounter, and then discharge him like through the process into a home in a bed for the night to continue his care. So just by, data tools around interoperability, of actually moving the needle in those real situations. And happier husbands.
Any other questions from our group here? All right, I do have one question. So as we look at the US, and we have definitely certain areas of the country that are wealthier than others, and then as we look globally, there are definitely countries that are significantly wealthier than other countries. How do we see the emergence of these technologies? Is it creating more of a gap, a health gap, or is it really enabling us to address some of the poor neighborhoods or countries around the globe? Any thoughts?
Okay, here we go. I am very, very hopeful that technology will enable us to create a society where everyone has access to cutting-edge assessment and treatment and education around health and well-being information that is trusted and validated and scientifically accurate. I believe that that's the moonshot that I would love to see happen in my lifetime. One of my dreams is to walk into Sick Kids Hospital and it's empty. I'm like, oh, I'm fired, great, let's go do something else. And I believe that technology enables us to do that. Of course, there's a massive risk that only wealthier areas or organizations will have access to it. However, I'm hopeful that that then gets democratized and passed out, and inevitably the cost of everything goes down to zero when it comes to tech, which then enables it to be spread around the world. So I'm super hopeful. I don't think it's happening in the next few years, but I'm confident that in my lifetime things are going to be infinitely better than they are now.
Yeah, I think it increases the access. Like right now, on our phone, you can take a college, course, right? You can do online learning from Stanford without needing the money or the time and the resources to go there. That's truly amazing. So yes, if we can bring that mindset and that access into this realm, yeah, that's super powerful. I think things like online chat boxes, like when I was at Orion, we worked with the Province of Ontario public health system for an online chatbot, where you could do a symptom checker and a free visit assessment and then get health information. That's great. It's free. It's available to every citizen, 15 million people. That access to health and wellness information, just having a more health literate society is really helpful to all of us.
Any thoughts, Amber?
This is more of an observation. It's just all of this, it's just so transformative. And then I'm thinking about recently with the weight loss drugs that became so popular, and Eli Lilly's prices being preventative for certain people to afford, and health insurance companies that wouldn't cover. And then what happened was these pharmacies spun up and they were making duplicates and all these online healthcare. I don't know how legit they were, but they were just popping up anywhere if you went to a browser, and there was just so much opportunity for corruption. I don't know how we'll regulate that in the future or what the right answer is, but technology is great, but there's also such a chance of, not really people just self-diagnosing everything. And
there's a Dr. Shmi Kang in Canada was talking about that, and she describes it like fire. Has this incredible potential to make societies like 10,000 years ago. It was an incredible thing, but you can also burn you. So we have to think of it like that as an infinite potential, but it can also be catastrophic as well.
All right, great. Well, that's all the time we have, folks. So let's give our three panelists a big round of applause. Thanks very much. Thanks for attending.